Moorditj Djena means strong feet or healthy feet in Noongar language. Moorditj Djena is a culturally secure, high-risk foot and diabetes education outreach service for Aboriginal people. We help to identify, manage and prevent foot complications resulting from chronic disease and to improve diabetes self-management. Moorditj Djena focuses on prevention and management of foot complications that result from poorly controlled chronic disease, for example, diabetes, peripheral arterial disease and peripheral neuropathy. In 2010, through the North Metropolitan Health Service and South Metropolitan Health Service, it was identified there was no podiatry services that directly targeted the Aboriginal population. Moorditj Djena Aboriginal Podiatry and Diabetes Education Outreach Program was developed and implemented in 2 locations, North Metro Health Service and South Metro Health Service. The 2 Moorditj Djena programs have since transitioned to East Metropolitan Health Service to provide outreach, podiatry and diabetes education services to the whole of Perth metropolitan area. Our vision and mission. East Metropolitan Health Service, Kura Mort, Moorditj Kwabarak, healthy people, amazing care. Moorditj Djena, strong feet, healthy lifestyle, positive community and culture. Our mission is holistic, culturally appropriate, community-based podiatry and diabetes education services, supporting Aboriginal people to achieve their health goals. Moorditj Djena aims to service Aboriginal or Torres Strait Islander clients or partners of with diabetes, peripheral neuropathy and peripheral vascular disease. We use a culturally appropriate approach to engage Aboriginal and Torres Strait Islander clients requiring long-term support in managing their chronic health conditions. The staff at Moorditj Djena consist of an administration assistant, a program coordinator, podiatrist, Aboriginal health professionals, a dietitian and a diabetes educator. The administration assistant is the first contact for patients attending the Midland Clinic and for patients and external services providers phoning the service. The administration assistant processes patient referrals, schedules appointments, organises support services for patients accessing the service and other clerical tasks. The administration assistant is also responsible for service data entry. Aboriginal health professionals or AHPs are often the first point of contact within their service. AHPs deliver health education, primary health care, care coordination and health promotion services to the Aboriginal community. A critical success factor for the program has been the key role played by Aboriginal health professionals within the service. The Aboriginal staff members have provided strong links to the Aboriginal community and have mentored and supported non-Aboriginal staff on the Aboriginal ways of working, communication and providing a culturally appropriate service.
See where it's 130 when you start getting into the yellow?
The senior podiatrist provides quality foot care to Aboriginal clients, particularly high-risk clients with diabetes and other chronic disease. The senior podiatrists identify and manage risk factors and provide treatment and intervention. They educate patients on foot care and other measures they can take to reduce their risk of problems and ensure greater overall health and well-being through self-management of their chronic conditions. The senior dietitian works individually with clients to ensure the client understands the requirement of a healthy lifestyle and diet to self-manage their chronic condition. For example, providing healthy eating plans for people with chronic conditions, ideas for low-cost healthy meals, help adapt favourite recipes to reduce fat, sugar and salt intake, and help in the understanding of reading food labels. The dietitian also provides food and nutrition education for community groups.
You might not need it long term, and that's where something like just using
The diabetes educator helps people with diabetes to self-manage their diabetes effectively and prevent complications. The diabetes educator can support and motivate clients in the management of their diabetes and refer to other services as required.
You beat first and you wait for the second beat and it's ready to go.
Moorditj Djena provides an outreach service to the Aboriginal community to 36 sites. Through the Moorditj Djena program, clients receive culturally appropriate podiatry and diabetes education services at various community clinics across the Perth metropolitan area, in a combination of community venues and using a customised mobile clinic van. Where there is a higher Aboriginal population density, weekly clinics are held in a number of key locations. Fortnightly and monthly clinics are provided in lower population density areas. Clinic attendance numbers and community feedback inform the services, locations and regularity of the service provision. The customised mobile vans allow the service to provide best practice service delivery to local community. They are fitted with appropriate podiatry treatment chairs and equipment, as well as awnings and air conditioning to cater for most weather conditions. The vans can also operate from a generator if no access to power is available, ensuring that they really can go almost anywhere. Most of the clinic locations are in partnership with other health and social services, providing services to Aboriginal people, resulting in a shared care approach. Formal agreements have been developed between Moorditj Djena and each partner agency, so that collaborative efforts are maximised in providing higher quality care to clients. This flexible delivery model has increased clients' access to the service. Clients can book an appointment or walk in on the day to access the service. The majority of clients attend the clinic without a formal referral through hearing about the service by word of mouth. The service regularly communicates with GPs, and promotional material about their Moorditj Djena service has been sent to practices. When a client is referred to the service by a GP, an acknowledgement of the referral is sent. This is followed by notification of the client's attendance and information regarding the client's presenting health issues, the care provided and care plan going forward. As much as possible, clinics are provided on a regular basis at the same locations on the same day of the week, fortnight or month, providing a stable service that can be relied upon. In addition to providing services close to home, clients who are unable to travel to the mobile clinics are provided with a cab charge to ensure the service is accessible. The client database assists with recalls and follow-ups with clients at intervals determined by the clinicians. Client attendance is greatly assisted by phone call reminders being sent to clients the day before their local clinic is scheduled.
My name's Eric Wynn. I live in Gosnells. I'm a part of the community engagement groups for Royal Perth and Armidale hospitals. Yeah, look, I had an ulcer in my foot. I had my foot debrived and scraped and operated on at Royal Perth in July last year, and it left a hole in my foot just about down to the bone, and the doctors wanted to cut my leg off straight after the operation because I didn't think it would heal up. But I wanted to be consistent, and I didn't want my leg cut off. I wanted to prove doctors that I can be compliant about attending a service that would help your foot heal, and I was compliant 2 times a week for about 6-7 months.
I'm Pat Oakley and this is my mum Ada Fossa. We're both Mulgana people from Shark Bay in Western Australia. As you can see, we're a long way from home. Services at Shark Bay are minimal. We're very regional, very isolated little community. Coming to Moorditj Djena has been a blessing for us, firstly that reason, but also I think with our health issues that we've been having lately, Moorditj Djena has been the perfect fit for us as opposed to more mainstream practices They've allowed us to be very flexible with when we come in, because at times mum's not the best.
My wound or the healing process has increased for the better. The dressings have changed from what it was to what it is now, and I don't have to walk around knowing that my leg won't be cut off.
I first found out about Moorditj Djena through my doctor at Derbyl Yurigan. I've been coming to Moorditj Djena regularly for the last 3 years, and Mum, you've been coming for the last 2 years, yep.
I'm very pleased with the services here. The people are always friendly and very kind, and I really appreciate the service they do. So coming from Shark Bay, where we have nothing really, just a silver chain, it's very beneficial to me, especially since I've had my operations.
Well, Moorditj Djena, they got some really good staff. They're culturally appropriate. They are understanding, and they don't come down on you hard. They educate you at the same time. It's a community service. They do get around a bit. I would encourage any community member, Aboriginal community member, to attend Moorditj Djena because of what I've been through, and it saved me a lot of other issues being affected.
Aboriginal people do have needs that don't fit into like mainstream services, or mainstream providers don't provide. So yes, it certainly complements our lifestyle, that's for sure, and accommodates us wherever possible. They go above and beyond really for what they need to do. But I must say, the actual service that's provided is top class, professional, and I can't fault them. It's like being in your own community. So yeah, we feel very comfortable here, familiar with all the staff, and yeah, they look after us well. Where else can you get offered a cup of tea?
My name's Shannon Elwood. I work for RK Health. I've been there 4 years. I'm a Wajak Balladong Noongar woman from the Wheat Belt. I started working for RK Health 4 years ago, and Moorditj Djena have always been the preferred provider for podiatry, just because basically they don't use EPC points or allied health referrals. They're free, they're culturally appropriate, they're located in most of the areas that we cover through our ITC program, which looks after chronic disease self-management. So we look after chronic disease and link patients to allied health services and support them to better manage their chronic disease. So I think it's good to access Moorditj Djena because they are culturally appropriate and friendly, and people feel comfortable accessing that service. Pathways work both ways. So Moorditj Djena often refer into RK Health and let us know, look, we've got clients that may need some support with footwear, and we link back to their GPs and chase care plans and things like that to support them to get the correct footwear as recommended by the podiatrists.
So my name's Teresa DeFranco. I'm a pharmacist credentialed diabetes educator from Perth Diabetes Care. And I've been working with Moorditj Djena to provide a diabetes education service for about the past 12 months. I think it's important that there is a diabetes educator as part of the service, as many people attending the service also have different forms of diabetes, type 1 and type 2 and others. And so to have access to a diabetes educator who can set them up with new technology, check the technology that they're using is working correctly, talk about insulin and injection technique, and make sure everything's as comfortable as possible and help make living with diabetes a little bit easier. And I think that's definitely a valuable service to have. During my time with Moorditj Djena, I've seen that it's a service that clients really enjoy coming to. The fact that there are many clinics across Perth, that it makes accessibility very easy. They don't need to book an appointment and can walk in, and it's very easy to access the service. And it works quite well having the whole team there together at different sites, because people can see multiple people on the one day and get that full service offering.